Hi, I'm Irene. It's nice to meet you. I'm one of the nurses here at the hospital. How are you feeling? You're good? Okay, yes, I'm very well, thank you. I'm just having a look at your notes, and it looks like we'll be conducting a neurological testing examination. Is that okay? Okay, good. So there's just a series of tests. I'm going to be jotting things down. I'm asking you a number of questions and getting you to do a little bits and bobs. So we're going to jump straight into it. So first of all, I want to check your mental status, okay? So if you can please tell me where you are. Okay, correct, good. And the date. Perfect. Okay, so I'm going to tell you 3 words now, and in about 5 minutes, I'm going to ask you to remember those 3 words and say them out loud. Okay? So I'd like you to remember apple, orange juice, and Wensleydale. So can you please repeat those for me? Apple, orange juice, good. And Wensleydale. Okay, good. So we'll ask you those questions in just a moment. So what I want you to do is I'm going to tell you a series of numbers now, and I'd like you to repeat them after me. Okay? So we'll start off easy. So 1, 2, 3, 4. Good. 5, 10, 15, 20, and 21. Okay, great. And one more. 30, 4, 8, 9, 41, 6. Okay. Good. Thank you very much. Okay, so we're going to subtract a number from 100, and I want you to let me know what that is. So if you can go 6, take away 100. Okay, good. And now I want you to keep subtracting the 6. Okay. Great. Perfect. Okay, perfect. Thank you. So I just want to ask you now what those 3 words that I said at the very beginning. Okay. Correct, apple. Orange juice. Great. And the last one? Wensleydale. Great. Perfect. So, I want you to name the things that I shout out to you, okay? So if you can please tell me what this is. Good. And here? Great. And what about this here? Perfect. And this here? Good. And what about this here? Okay, good. Perfect. So now I'm going to get you to follow some commands now. So I'm going to give you 2 commands, and if I can get you to do those after I've said them, okay? Okay, so I want you to blink 3 times, and then I want you to put your finger to your nose. Good. So now I want you to point to your mouth, blink once, touch your nose, and with your left hand, I want you to scrape down the bottom of your head. Good, good, perfect. So the next thing I want to do is I want to check your cranial nerves. So this one's going to be pretty quick. so I'm going to start with the eyes. So first of all, I have 2 pairs of gloves. Can you please tell me which color they are? Okay, and do you have a preference for which one you'd like me to use? The orange ones? Okay. Okay, so I'm going to be using a light in your eyes, and this lets me have a look on a much deeper level, and we're going to check your pupil dilation and your eye movements and things like that. So first of all, I'm going to get up real close, and I'm just going to palpate just around your eyes, okay? Great. So I'm just going to get you to, if you can just look straight ahead for me, and I might block in your way, but if you can still keep looking just behind me, and I'm just going to come a little bit closer, and I'm just going to have a look. Okay, good. And just palpating, just having a real good look at your eye. And I want you to, I'm gonna lift down your eyelid now, and I want you to move in the direction that I ask you to, okay? So I'm just gonna push this eyelid down. Good. And I want you to look up for me. Okay. And look down for me. Okay. Good. And look to the right. Okay. And look to the left. Okay, good. And I'm just gonna flutter around your eye for a second. Okay, good. And I'm just gonna come over to the other one now, and same again. I'm just going to palpate just around that eye. Good. Okay, good. And I want you to, same again, look in the directions that I asked you to. So we're just gonna look, pull this down here, and if you can look down for me this time. Okay, just having a look. Good, and if you can look up for me. Perfect. And if you can look to your right. Okay. Good, and to your left. Okay, perfect. And a little bit of the pitter patter just around your eye. Good, perfect, thank you. And I'm just going to take the light now, and we're going to do a swinging flashlight test. So it's just going in and out in the direction of your eyes, okay? Okay, so if it gets too bright, please let me know. So I'm going to go, so keep looking straight ahead. So in and out. It's only for a couple of seconds. So we're looking at your pupil, well, both of your pupils, making sure that they dilate and constrict. When I do place the light on here, and just on the other side, this one here. Good. So we're just going to quickly check your peripheral vision. So I want you to keep your head straight, and I'm going to come in here, and if you can tell me, if you just point to which hand where my fingers wriggle. Okay. So Keep looking straight ahead. Good. Great. Perfect. Perfect. Thank you. Okay, so what I'd like you to do next is I want you to cover one eye for me, and I'd like you to follow my finger, keeping your head still, moving your eyes only. Okay, good. So if you'd just like to cover that up for me. Good. So okay. Good. Just going to come a little bit closer and back out, and a little bit closer again and back out. Perfect. And we're going to do exactly the same again on this hand, okay? So we're going to go in and out. Then out. Good. Good. You're doing really well. Okay. Okay, good. Thank you. Now I'm just going to have a deeper look inside your eye, okay? I'm using this device here, and this just allows me to see past the eye. So it's going to get just a little bit bright, okay? So I want you to keep looking straight ahead. And I'm just getting the right. Look at one eye for now. Okay. And I'm just gonna come up and inspect the eye so I can see. Okay. Good. Looking good. Perfect. Thank you. And again, just with the other eye, same inspection. Okay, so I just want to. Okay. Okay. Good. Perfect. Okay. Great. Thank you. So that is looking wonderful. Thank you very much. And I'll just let you have a moment just to blink and get your eyes back to the natural light. And one last thing I'd like to do, but I'll just give you a moment. Okay, might just write a couple of notes down before we just carry on. So, I like the mental status is looking good. A few little mistakes here and there, but that's okay. It's nothing worrisome. Okay, so you subtract your numbers from 6 to 100 perfectly. Okay, good. And the commands, perfect. Okay, so eyes, your reflex, wriggling fingers, eye movements, moving fingers. Okay. Thank you. Are you feeling okay to go ahead with your eyes? Okay, good. There's just one little last test on this one. So I just have a eye chart here. And what I want you to do is I want you to see if you can read the bottom line for me. Okay? Okay. Perfect. You just need to try your best. Doesn't have to be 100%. Okay. Great. And if you can just say the first letter at the top. Okay. Good. And if we just go down to the middle here, if you can say those letters there. Perfect. And if you can say them starting from the back as well. Okay. Perfect. And if you can please just say the numbers down from 9 to 1. Okay. And then back again. Okay, good. And is there any numbers here that you can read? Not much. Okay. Do you wear glasses at all? Okay, good. Thank you. Okay, so the next thing we're going to do is I'm just going to take these gloves off because I touched my face. And we'll pop on some new ones. Might try those green colored ones this time. So we're going to now be testing your facial movements. Okay. And it's also testing the muscle in your face. So I'm going to do some silly things now, okay? So don't feel too silly when you do them. So what I want you to do first is I want you to smile and show me all of your teeth. Great, perfect. And I want you to frown for me now. Good, thank you. And if you can look sad for me. Perfect. Okay, lovely. And if you can just raise your eyebrows and raise them twice, so put them down and up and down and up. Okay, good. And now I'm going to get you just to open up your mouth, and I'm just going to take a look inside. So, open wide, okay. Just looking at your tongue. Okay. And that is all looking good. And if you can just lift your tongue up for me. Okay, good. That looks great. Perfect. And if you can just open up your mouth again for me and go, ah. Okay, and again. Ah. Okay, perfect. Thank you. Now what I'd like you to do now is I'd like you to put your tongue on your cheek. Okay, so just like that. Okay. And I'm just going to press it, and don't let me get inside, okay? Okay. Good. Perfect. And just on the other side. Good. And don't let me push it in. Perfect. Good job. And I want you to raise your tongue to the roof of your mouth. Okay, good. And butt down again. Okay, good. And if you can just go and then up and down. Okay. Perfect. Great. Thank you very much. So your tongue looks good. There's no cracks or anything like that. Okay. So facial sensation. I'm just going to touch around your face. Okay. So coming a little bit closer. Okay. Good. A little bit on your nose. Thank you. And what I get you to do now is I'm going to get you to turn your head for me on both sides. Okay, so now you've gone onto your side. I'm going to press my hand against your cheek and resist it, okay? So we'll just start here. Okay, so turn your head. Good, and resist. Okay, good. Pretty strong. And just on the other side. Okay. Okay, good. Now, I'm just going to place my fingers on your cheeks and all of your face on each side, and if you can tell me that it feels the same. So, okay, here. Feels the same? Okay. About here and here. Good. And here and here. Perfect. And just on your jaw, so here and here. Okay, good. Thank you. Now I want you to close your eyes for me, okay? And can you tell me how this feels? Cold? Okay, good. And here, does it feel exactly the same? Okay, good. And just on your, feel the same? It does? Okay, good. And what about here? Okay, good. And here and here. Okay, good. Perfect. Thank you. Okay, so before we get onto the motor system, I just want to check your hearing, okay? So I'm just palpating your ears. Okay. Now, if you just close your eyes for me and just point to which ear that you can hear this sound in. Okay, good. And again. Perfect. And this side. Okay. Perfect. Good. Thank you. And I'm just going to palpate around here. There's no pain or anything. Okay. Okay, good. And just checking on this side. Okay. Perfect. So I'm going to whisper just a couple of things inside your ear, and if you can repeat them, you can open up your eyes now as well. Okay, so wine, chocolate, berries. Wine, chocolate, and berries. Good. And just on the other side now. You ready? Okay. Beer, sun, chocolate. Beer, sun, and chocolate. Good. Perfect. Thank you. So I don't need to have a look inside your ears. We just want to make sure that there's nothing on the outside that feels uncomfortable. And definitely just want to check your hearing to make sure that part of your body does work. Okay, so we're going to go on to your motor system now, okay? And I'm just going to have a visual look first at your overall, your arms and your legs, etc. Okay. Perfect. Right down to your toes. Okay. Nice socks. Very nice. Okay. Good. Perfect. Thank you. And what I want you to do is I want you just to shrug up your shoulders for me. Okay, so as high as possible. Perfect. And if you do that again, I'm going to try and push them down, but if you can resist that. Okay, good. Perfect. Thank you. Okay, so I'm just going to have a look at your arm. So I'm just going to go palpate each side. Okay, good. And at your hands. Okay, good. And just on your other arm. I'm not feeling anything strange. Don't have any pain anywhere. Okay, good. And looking at your hands, phalanges, metacarpals, and carpals. Okay, good. Okay, good. And I'm just going to get you to close your eyes for me. And if you can please tell me if this feels sharp or dull, okay? Okay, good. Sharp, dull, okay. Sharp, sharp, okay, perfect. And just on the other side, so dull, okay, dull, sharp, dull, sharp, sharp, dull. Okay, good, thank you. Okay, so now I just want you to relax your arms and your hands, okay? And I'm just gonna wriggle them around a little bit, okay? Okay. Okay, good. Perfect. Thank you. And on the other side. Okay, just relax that one a little bit more. Twist that one around. Good. No pain, no discomfort. Okay. Okay, good. Thank you. And I'm gonna test this again. So, does the cold feel okay? It is cold. And what about here? Same here. And on your hand at the top. And then in your palms. Okay, good. At the top here. At your palms. And top. Okay, good. I'm just going to quickly go down to your legs now. Okay. And I'm just going to have a little feel. Okay. Good. There's no fluid retention, edema, or anything like that. Doesn't look swollen. Okay. We don't need to take your socks off, so you can leave them on. Okay, good. And on this side, just initial inspection and feel. Okay, good. All right. And how does that feel? Feels okay? Okay. Good. And again, I just want you to close your eyes, and I'm just going to use this again. I just want to know if you can feel it. Okay? So we'll go down. How does that feel? Okay. Okay, good. Sharp. Okay, and sharp. Okay, perfect. Thank you very much. And again, we're just gonna wiggle around those toes, okay, and the feet. So if you can just go floppy for me, Good. Good. Okay. And to the other one. Floppy, floppy. Okay, great. Okay. Perfect. Thank you. Okay, so that looks good. Okay, so what I want you to do is I want you to hold your hands out, okay? And I want you on this side is just to go like this, as fast as you can, okay? Okay. Perfect, thank you. And if you can do that on the other side. Okay, a little bit faster. Okay, great, thank you. And now what I want you to do is I want you to go like this. Perfect. And if you can do that on each finger for me, okay? Good. Okay, perfect. And I'm just gonna squeeze on your fingernails. And the blood comes back less than 2 seconds, which is good. Perfect. So I want you to close your eyes again, and I want you to place your arms out like this, okay? And I'm gonna count to 5. This is just making sure that there's no obvious dip down or high up when you have your eyes closed, okay? Okay, so keep them long. Perfect. Okay, so 1, 2, 3, 4, 5. Okay. Now I want you to switch now your palms. So instead of going like this, I want you to go like this. Okay? And again, 1, 2, 3, 4, 5. Perfect. Good. Now I want you to just stand up for me. Okay, good. And I want you to lift your leg up with one hand out, okay? And we're going to count to 5 again, okay? So do it as best as you can. If you fall, that's fine, okay? 5, 4, 3, 2, 1. Okay, good. And again, on the other side. Perfect. 5, 4, 3, 2, 1. Okay, perfect. Now you can sit back down. I'm going to be using the reflex hammer. I'm going to check your reflex now. So we're just going to check on your elbow first. So good. And just on your wrists. Okay, good. And I'm just going to go down to your feet now. Okay, so we'll try just your patella. Okay, good. And just down to your ankles. Okay, so just at the back of the foot here. Okay, good. And I'm just going to start from your other foot now and work our way back up, okay? So perfect. And now your patella. Good. And to your wrists. Try that one just again. Sorry. Perfect. And at your elbow. in. Okay, good. Thank you very much. Perfect. Okay, so I've just got one more thing to do, and then I can let you go. Okay, perfect. So, sorry, I've got two things for you to do. So what I want you to do now is I want you to hold onto your nose. So I'm going to point at your nose, and then I want you to point at my finger. Okay? So no, nose, finger, nose, finger. Okay, and I'm going to move around in different positions too. Okay? So let's go. Good. Perfect. Perfect. Okay, good. Perfect. Thank you. That all looks great. Perfect. And I want you to stand up now. And what I want you to do is I want you to just walk normally. Okay, so right across the room. Okay. Good. Perfect. Thank you. And if you can walk back for me. Okay. Okay. Good. Perfect. Now what I want you to do is I want you to place one foot in front of the other. Okay? Good. And keep walking like that. Great. Perfect. And all the way back again. Okay. That looks really good. Thank you. Okay. So we are done. I bet you're glad that that's over. Good thing is that you will only need this every few years unless something happens to you. So, okay. Everything looks perfectly normal to me. There was some slight differences in a couple of things, but that's okay. Not everybody can get 100%. I certainly don't. There's not much here to say other than everything looks good, and I can just pass this straight on to the doctor, and then you can go on from there, whatever you'd like to do next. Okay? Perfect. Okay, good. I think I have everything that I need. I just double check. We did everything. Okay. I guess I could just test you one more time. Do you remember those first 3 words that I told you about? You do? Okay. Apple, great. Orange juice. Wesleydale. Perfect. Okay, 5 stars. Great. Well, when you're ready, I'll just go outside the room. Freshen yourself up, etc. And I'll meet you right at the front of the reception. Okay? Great. It's nice to meet you as well. Okay then. Goodbye.